Medication abortion is common practice in many countries, including USA and European nations, and it's usually allowed within 12 weeks of pregnancy. Before we delve into details, we should say that this video is educational purposes only and should not be used as a substitute of professional medical advice. There is huge debate about abortion. We have two sides. First is pro-choice and second is pro-life. Pro-choice says that everything rests on women and it impacts on woman's body and her life, so woman has right to choose abortion or not. Another side is pro-life. Pro-life people and pro-life supporters says that fetus has a right to live. Now let's say about medication abortion. For medication abortion, used two drug combination. First is Mifepristone and second is Misoprostol. Mifepristone 200 milligrams and Misoprostol 400 micrograms. Now let's say which is first and which is second and why. First is Mifepristone, and woman takes Mifepristone first. It blocks progesterone, and progesterone is crucial for continuation of pregnancy. And without progesterone, lining of the uterus breaks down, and it causes termination of pregnancy. So lining of uterus starting to break down, it causes termination of pregnancy. That's the idea of Mifepristone. After Mifepristone, it is intaken by orally, and after Mifepristone, woman gets Misoprostol, but period between Mifepristone and Misoprostol should be 12 to 48 hours, so 1 or 2 days. That should be period between these two drugs. And what Misoprostol is doing, Misoprostol induces uterine contractions and it expels the pregnancy through vagina, and symptoms after Misoprostol looks like heavy menstruation. It's cramping, heavy bleeding, and sometimes clots. Nausea, vomiting is common, diarrhea, chills and warmth, sometimes fever, but this fever should not exceed 38 degrees Celsius or 100.4 Fahrenheit. And heavy menstrual period is common after intaking Misoprostol because it causes contraction of uterus and expel the pregnancy through vagina. After this procedure, confirmation is needed. Confirmation occurs after 1 or 2 weeks after intaking these drugs, and this ultrasound confirmation is needed to verify pregnancy termination. It's important part. And if we say until when it's recommended within first 10 weeks of pregnancy. So after 10 weeks effectiveness drops, and it's important to after 10 weeks usually common practice is surgical abortion and not medication abortion. And at this case, before 10 weeks, this combination of drugs has 98% effectiveness, so very high effectiveness. Now let's say what is contraindication of these drugs. Ectopic pregnancy is important. Ectopic pregnancy is rare actually, but important because this combination of drugs cannot affect ectopic pregnancy. Also, lack of access to emergency medical care. It's important because sometimes it's rare, but sometimes uh, heavy bleeding occurs, and sometimes emergency medical care is needed. That's why it's important. And misoprostol intaking ways is buccal, sublingual, or vaginal. These three ways. Usually, most common is sublingual and buccal. Now let's say what is red flags. Red flags means when women need emergency care, and when on what symptoms women should be very careful. It's heavy bleeding. Heavy bleeding means swallowing 2 or more pads per hour for 2 hours or more consecutive hours. So if within 1 hour 2 or more pads are swallowed, it is considered as heavy bleeding. Another important symptom is high fever. High fever more than 38 degrees Celsius could be signal of infection, especially if it persists more than 24 hours after intaking misoprostol. So it's important to monitor fever also, because high fever at this case is a sign of infection. And important is here also, pregnancy symptoms can last for several days. So after abortion, pregnancy symptoms still can last for several days, and pregnancy urine test may still be positive, because human chorionic gonadotropin hormone, it's hormone which causes such symptoms, and also this pregnancy urine test is based on this hormone. This hormone presence in the urine continues, so it needs several days to drop significantly, and after this symptoms such as nausea and such symptoms will cease, and also urine pregnancy test becomes negative. That's important also. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.